So I'm a physician with a focus on MDS and acute myeloid leukemia. And one of the things that we've learned about those diseases is that there are actually many cancers within each patient. We've had many clinical trials. I got a point into my practice where I was frustrated that there were large groups of people with MDS and AML that didn't really fit into one particular clinical trial with a targeted therapy focused on one gene mutation. And so as we were doing whole exome sequencing and very large gene panels, we found that people's cancers, their leukemias, their MDSs, contained hundreds of genomic abnormalities. And so it started to not make sense to me and my group that we were giving one drug for one gene mutation. So we wanted to ask the question, is there a way that we could devise a therapy that was informed by the hundreds of genomic abnormalities inside the patient's MDS or AML cell? And so several years ago, we searched for a software engineering firm that was capable of doing that. We didn't find any. And so we searched longer and we waited some more time. We found some companies that were doing some systems biology research, but they had no interest in testing their technology in the clinic. And about 5 years ago, we discovered Cellworks. Cellworks was one of the few software engineering companies that had the capability of doing simultaneous mapping of hundreds of genomic abnormalities, and they were brave enough to go with us into the clinic. And so what we did first is we challenged Cellworks to see if they could take some of our archived data that we had, the genomic data on our current patients. And we had them model our patients that we've already treated, and we didn't tell them what the outcomes were. We told them what drugs that they treated the patient with, and then they reported back to us on whether their computer system thought the patient responded or didn't respond. We unmasked everyone, and we found very high accuracy, about 80 to 100% accuracy of the Cellworks technology, and looking backwards at our data. That gave us the confidence to then start a new clinical trial. This is iCare1 now, a prospective clinical trial where we recruited patients and did the whole exome sequencing and to see if the computer modeling could predict the outcomes of these patients. In iCare1, we found that the Cellworks technology had a 90% accuracy in predicting the clinical response in our blood cancer patients.